Hello there, my name is Annie Thomas. I'm a primary care nurse practitioner. The purpose of this video is to explain all about basal insulins. In this video, you will see what is a basal insulin, who should be started on basal insulin, and how do you start them on basal insulin. To make it even more simpler, let's review two cases together. Let's say you got Mr. Singh in your office today. He has an A1C of 9.5 and a history of diabetes over the last 15 years. He has maxed out on all the oral medications, including glycoside, metformin, and Januvia. How do you manage this patient's A1C? I guess the answer is pretty straightforward here. To help him achieve an optimal glycemic control, you have to start him on basal insulin since you got no other options remaining now. And what should be the dose? You can always start him at 6 units or 8 units. I often start patients at 6 units. But say you're not comfortable starting at 6 units, you can choose maybe 2 units or 3 units. You can start anywhere less than 6 units. It's okay. However, you make sure that you call the patient at least every 2 to 3 days to increase his basal insulin dose by 1 unit up until his fasting blood sugar is below 7. Again, you're increasing the basal insulin dose by looking at the fasting blood sugar result. And most common basal insulins are Lantus and Levemir. The beauty of these insulins are they don't have any peak levels, so the patient is at very low risk of having a hypoglycemia. Also, these insulins act up to 24 hours. So that's about basal insulin and the basal insulin dosing. Now let's go to the second case. Here you got Mr. Smith. He has a history of diabetes over 10 years. His A1C is 7.1. So we know that an A1C of 7.1 is a beautiful number for anybody who has a history of type 2 diabetes over 10 years. Mr. Smith is also taking metformin and glycoside, but he's only on glycoside 60 milligrams. That means there is still a room for us to increase the medication dose if there be a need. However, his A1C is perfect. But you also happen to notice that his fasting blood sugar is 10.2. So definitely there is something wrong. You got a patient sitting right in front of you who has high fasting blood sugar yet a perfect A1C number. That means you have to ask the patient further questions. You have to ask him, do you have hypoglycemia or low blood sugar? And here he goes. He says, yes, sometimes my blood sugar dropped to 3.8 or 4.2 or 4. So now you've got the answer why this person has a perfect A1C, because he has a mixture of high blood sugar and low blood sugar, which when averages it out gives a perfect A1C number. Here my question to you is, do you choose to treat this patient because he has high fasting blood sugar, or will you send him home because he has a perfect A1C number? If you were to choose to treat him because of his high blood sugar, what do you do? Do you increase his secretagogues, or will you start him on a basal insulin? To learn more about this case, please visit www.nursepractitionersupport.ca. Thank you for watching us.